You know, guys, getting older can mean a lot of changes to your skin, especially your face, but there's no reason to live with wrinkles and other little imperfections if you really don't want to. Joining me now is our plastic surgeon, Dr. Elie Levine, and our dermatologist, Dr. Jody Levine. Good to see you guys again.
Great to be here.
All right, so one of the things people are just so deathly afraid about is fillers, right? Mostly because people have bad work done, right? I mean, you see them walking down the street a mile away, giant lips, but Jody, really it's in the hands of the surgeon, isn't it? Or the dermatologist in your case, right?
Yes, I think lips is a perfect example. People have horrible lips out there, and I think the right doctor can give you natural, beautiful lips.
Right, and I want to show some of the before and afters to just prove that that can be the case, because it really is, I think, in my opinion as well, subtle is better, and I think people are really happy with that. So let's just talk about some before and afters. Here's some before and afters. What do you have here?
Yeah, so here we see Juvederm to the lips, which is made from a sugar, hyaluronic acid. It's found naturally in your body, and I just augmented the border of the lip as well as a little bit in the meat of the lip. And also the philtrum, which is this area right here.
Right, just below your nose where those little lines are there, right?
That's right. When you puff that out a teeny bit, it adds a very sexy look.
Right, it gives you that little perk up look that a lot of women would like to have. Okay, and so again, very subtle and a nice approach. And you have another before and after. Let's talk about that one.
That's right. It's the same thing. I just wanted to give you two versions.
Right.
It's the other thing I do is I add a little bit of botox to the top of the lip. And that enhances the look along with the filler. It also helps the filler last longer. Yeah, doing a little Botox there can also get rid of those little horizontal lines, right, that people get when they get older there, and that just makes the whole thing look that much better. That's right. Yeah, and people should not be afraid of that as well. All right, another thing that you guys do is you fill under the eyes. A lot of people feel like, you know, they get either a hollowness or maybe a little bit of bags in there, but you can make that stuff go away, right? That's right. It's like using concealer. Right, but better. But better, of course. Exactly. So let's talk about your before and afters here. So here we see also a hyaluronic acid filler, and I stress that because it's natural. It can be dissolved if someone doesn't like it, which rarely happens, but it's good to know it exists. And we just fill the hollowness under the eye. And it really makes it look younger and rejuvenated, and can it get those little wrinkles sometimes out of their way, right? It can, and it basically mimics what Elie does surgically. Of course, the surgical option is more permanent, but this is a nice alternative. Yeah,
it's a really great alternative, because there's some people that either aren't surgical candidates or don't want to do surgery, and they have a little bit of puffiness in their lower eyelids, and it's a great camouflage technique. And sometimes people say, you know what, I really want to do surgery, but I want to get a hint of what I'm going to look like after surgery, and it gives them a subtle look at what they will look like if they do their lower eyelids. But there are some people, though, that have lower eyelids, maybe bags that are too big, that, you know what, you really don't want to fill them. They need to see the surgeon. And what's the difference there? It's really just a nuance. It's just getting a sense of just how prominent their puffiness is. And despite that, there's certain people that say, you know what, let's try the filler first, because there's really not a significant, you know, it takes about 4 to 6 months to fully, you know, dissolve. And so it may set back the time a little bit, but other than that, there's no real harm in trying it. Right, and you can always dissolve it, like you said, if someone doesn't like it. All right, so we have another set of pictures now. This addresses more of the facial volume, something that people don't realize we lose as we get older. So let's talk about this. The first set of pictures is where you guys inject something called Radiesse. Talk to me about that. So Radiesse is a synthetically derived calcium-based product, and it has a little more integrity and strength to it than some of the hyaluronic acid products like Restylane and Juvederm. And it's really great for volumizing the cheek or treating the lower face, a marionette area, where you just need a little more strength to really lift that up. The other thing that's really nice about the product is it lasts a lot longer. Right, and so we have some before and afters there for people to see the difference, because it really is fantastic the way it lifts, and sometimes it can get rid of those little lines in here as well, which is nice because you replace that volume. How long does it last, so people who are wondering? I tell most of my patients about a year. Right, about a year or so. Yeah. Okay. People don't always realize that they need volume. You lose volume from losing weight, but also naturally as we age, we lose fat, we lose muscle, we lose bone. And adding a little bit of volume with a filler just lifts you up, and it makes you look more awake, it makes you look happier. Right, I don't think people realize the power of that, and then you get it and go, oh wow, look at that, it's fantastic. Okay, the other filler is something called Sculpture, which does similar things but works differently. Tell me about that, That's right. We use Sculpture for more global filling, for someone who just, their whole face needs volume. And Sculpture is interesting because what it does is it causes your own body to make collagen, and thereby it lasts longer.
Right, but you need multiple treatments for sculpture, right, coming out at the top?
Correct. We usually do 2 to 3 treatments in the beginning, and then it lasts for over a year.
Yeah, but the results, though, I mean, the before and afters, again, are pretty dramatic, right? I mean, what do you find?
They're dramatic, and with all of these things, whether it's a sculpture or any of these, there's essentially no downtime with it. There's not a big recovery. If someone's not on an aspirin type of product, typically they don't bruise from it. So these work really nicely for someone who wants to come in on an evening, on a Thursday or Friday, and be back at work without anyone knowing they've done anything.
Right, but they better be off of those medications, right, for about a good week or two. Right? A lot of people take anti-inflammatories and things like that, and some supplements as well, like fish oil and vitamin E. Right, we want to be off of all those things. Guys, thanks so much. Some great information, really, and some amazing work. Thanks for coming in.
Take care.
Thanks for having us.